Hi everyone, welcome to Self-Balance Live. I'm Szenan-Balance from Self-Balance, the acupuncturist. Well, today's topic, we're gonna talk about non-surgical treatment of appendicitis. Non-surgical treatment of appendicitis. Well, I actually shared a few nights ago. I shared that my appendicitis experience. It was way back in the first year in my university, and I talk about after the surgery, my master anatomy teacher professor. He told me he told me that he actually told me that you are stupid, you know. And why did he say that? Because he was a surgeon. Then he decided to give up surgeon, and then came to a university, traditional Chinese medicine University of Shanghai, to learn Chinese medicine, because he believed in Chinese medicine can treat everything, right? No problem. Sylvia Chen, thank you for your lecture. You're welcome. Thank you for supporting. Then, okay. The story, my experience of appendicitis. I had a surgery and I removed it. So he told me that I'm stupid. And he gave me an idea. That idea, I appreciate that so much. He told me that, well, in the old time, 1,000 years ago, if a pregnant woman suffer from appendicitis, what did they do? They can't give her surgery. What did they do is they actually give them Chinese herbs to heal it. Then I asked him, because he was new in our school as a teacher, he didn't know how to fix it because he didn't learn Chinese medicine, but he read the case study and he told me that. So that always in my mind. I was searching and searching and searching. One day I was lucky that I followed one of my master. He actually is using Chinese medicine to treat cancer and infertility. And I've seen him that treating a patient who had fractured bone. 7 area. 7 is he's doctor. He had motorcycle accident. 7 bone fracture, and he didn't get surgery. He get his uncle to put the bone back and put Chinese medicine, and ask my master to prescribe Chinese herbs for him to take every day. And he got all better from Chinese medicine. Then my master showed me exactly how I can treat appendicitis without surgery. And I found I was so lucky that I found my master Bian Songjing. He is now 80 something years old, still seeing patients in Shanghai. Now, one of my seniors cousin who suffered from appendicitis, 10 years old, and he came to my master. The master used Chinese medicine within 1 week, no problem, fixed. No need surgery. No need surgery. Okay, get back to my case. This patient came in one morning and said, "Wow, tummy pain because mom is here for acupuncture and grandma here for acupuncture in our clinic." But she had discomfort for the last 3 days, and it got quite painful in the tummy. Pain is over here. It's over here on the ribs. I said, okay, lay down. Let me press it. And I press it. Okay, it's painful in here. It's painful. Is there any pain in here? No, no pain in here. No pain in the back. Because I first actually suspect that was a gallstone. But okay, wasn't sure. Then I check here, McBurnet's point, 麦氏点. This point is where you check the appendicitis. If that point is painful, then that is pretty sure it's appendicitis. Then I did that point. Wow, that's painful. So for appendicitis, normally when you get the pain, it's actually from here, 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 and then it moved to pain only in here. So in this case, I checked this one. I said, okay, I think I know what's going on. You suffer from appendicitis. And they said, really? I said, let me check another point. I went in to the leg, stomach 36, which is 足三里. So 1 chun below stomach 36, there's appendix point. So if you suffer from appendix problem, appendicitis, and this point will be painful. So I had one patient in this point, he had actually a big lump in there. When I put my finger in, only on top of the skin, just rub on top of it, it was, oh, that's very painful. So I'll tell you, this is not my first case in New Zealand. I treat appendicitis without surgery. So in this girl, this patient, she had painful in here when I tap it there, even painfuler than stomach 36. So stomach 36, if you press harder, it's gonna be a bit of tenderness in there, right? But this point, appendicitis point, is more painful or more sensitive than stomach 36, and that indicate appendicitis. Simple. All right. And I said, well, you need to go and get a blood test. Go to a GP, get a blood test. And if the blood test white blood cell is high, then I'm pretty sure you have appendicitis. Right. Then she went to Reagan, because the GP is in Reagan. She went to Reagan and saw a doctor in that afternoon. Oh, we did acupuncture, and I want to share with you what acupuncture point that I choose for. And if you're an acupuncturist, you know when you have this kind of patient, you can just put needle in, it works. So I can guarantee it's gonna work for you, because I've tried a few times for my other patient as well. Then, okay, this patient went to GP, because I'm just an acupuncturist. But what people don't know about me is I have 5 years study in Shanghai, and I study Chinese medicine and Western medicine. Okay, and I have the knowledge of Western medicines, and I could be a surgeon in China if I wanted to. I can just take a few exams, spend a few more years, and become a surgeon, because we have the knowledge. But I decided not to do this because I love Chinese medicine. I believe in Chinese medicine. And again, if I become a surgeon there, I came here, I wouldn't be able to practice anyway. So in here is different system. Now, okay, she went there and see her GP and said, well, I have stomach pain the last 3 days, and I went to acupuncture. I feel better now. She told me that. She told me that I felt better, a bit better after acupuncture, and the acupuncturist say that I suffer from appendicitis. And you know what? The GP actually laughed. Ha 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 ha. What did he know? He's just an acupuncturist. Of course, I'm an acupuncturist, but you didn't know that, as well as I have all the knowledge of Western medicine. I was studying Western medicine as well as Chinese medicine. That is why that I know how to cut down medication for my patient. We do it successfully to use Chinese medicine to treat diabetes, high blood pressure. We help patients to cut down medication, eventually stop all the medication. Only few people can do that. Not many people can say that they can do that. And we have successfully do that. Many cases now, clinic. Of course, not just through Chinese medicine and acupuncture. We always share with our patients, encourage them to change lifestyle, to change diet from eating meat to a vegan diet, because the vegan diet is the best. Vegan diet can help you cut off medication. I've seen a lot. All right, we have put off topic, and the doctor actually get my patient and lay on the bed and go and check the tummy, and then when check her the point, it's painful, and she said, "Oh, yeah, I think you do have appendicitis." Then prescribes the no drugs, no nothing, just prescribes the and the skin, and as well as a blood test for her to go and get blood test. Unfortunately, we haven't got the skin and blood test report yet, and she decided to not do skin and just do blood test, and we haven't got a blood test result yet. But anyway, that was how many days now? About 4 days now? Yeah, about 4 days now. Yeah, about 4 days now. And she pretty much all better. She is pretty much all better. And how did we actually treat it? I gave her so far 3 acupuncture. 3 acupuncture. I'm gonna share with you the acupuncture point today, and I'm gonna share with you what sort of herbal formula that I use for this case. If you're an acupuncturist and Chinese herbalist, you know what I'm talking about. If you're patient, hey, this is just a live video for you to get more information. You may not have appendicitis, but one day, if your family, your friend who suffer from appendicitis, you have options. You can either go for surgery, or you can come to us for acupuncture in Chinese medicine, and we will help you get rid of appendicitis. Right now, you have choices. Surgery is not the only options, but if you go Google will tell you, or the doctor will tell you, surgery. That's not true. That is not true. We can help you with non-surgical treatment for appendicitis. Now is the time to share with you what is the point. The acupuncture point, we use Dr. Tan 8 magical point. Dr. Tan 8 magical point. Right. So on here, you do level 4, Sanjiao 5. On that side, level 8, and spleen 9. On that side, lung 7, PC 6. On that side, stomach 36, GB 34. That's it. Right. I'm not going to repeat. You can Google it. That's all on the website, Dr. Tan Magical 8. You can do Magical 8 plus 1 as well if you want to. And this is Hard 8, I think. Oh no, can't remember. It's called they call Ling Dao. I don't know the number in here. Okay, that's Magical 8 or Magical 8 plus 1. You also can use other point like scalp acupuncture, or you can use, I use G acupuncture in one stage. After needles, that she still feels some pain in there in the second treatment, and I went away, go ahead and do G acupuncture. That's it. And what about formula? So I took pulse, and I feel pulse that one side is stronger than the other side that is running. So running formula is a bit more complicated. And if I tell you, you can't practice this. Why is that? Because it need the technique of diagnosis. Then let's say about in all my cases, I treat appendicitis and learn it from my master. The one formula, classic formula, 伤寒论 classic formula is 大黄牡丹汤. 大黄牡丹 is the greatest formula for appendicitis. In the beginning, if the appendicitis bursts, if it bursts, and there's different formula. Anything if it's not burst, there's 大黄牡丹汤. Okay, and 大黄牡丹汤 can go with 大柴胡汤 as well. 大黄牡丹汤 can go with 大柴胡汤. Okay, now 大黄牡丹汤 is in this way. 大黄牡丹汤 it's got few 5 different herbs. 芒硝, 大黄, there's past the bowel motion, and 桃仁, 芍药, and 桃仁芍药, 冬瓜子, 5 different herbs in there. Of course, you can add on 大柴胡汤 if that is if the symptom is similar in 大柴胡汤. You can use both formula, but in this case, I use this as well as 桂枝茯苓丸 because 桂枝茯苓丸 can move the blood better, right, to stop the pain. Yep. So only simple formula, and she came back today, much better. She can eat now, and not much pain at all. Just about all good. That's it. Easy peasy for appendicitis treatment. No need surgery. Within 1 week, all good, right? So I hope you learned something from this video. Hope that this video actually helped, informative to you. And if you are in Hamilton, so this is our phone number, 078467956, 078467956. I think we are quite confident to deal with appendicitis. You have to get the right person, okay? Not everyone will help you, okay? Because like in my experience, I went to my master, one of my professor teach me in my first year, and I asked him whether he can prescribe Chinese for me to deal with my appendicitis so I don't need a surgery. He said, no, go for surgery. You see, because he didn't have this experience. He didn't actually believe in that Chinese medicine can treat appendicitis. Not until about 3 years after that, I met my master. And my master told me that, hey, my master showed me that, hey, we can use Chinese medicine to treat appendicitis. I learned from him. And I keep the knowledge until now. So whenever I have the chance, I treat 1, 2, 3, 4, about 4 or 5 patients in New Zealand. Of course, not everyone get to know me to know what I can do for them. But I'm here to share the knowledge, to share the message. All right, stay awesome, and I love you all. I'll see you tomorrow. Bye-bye.